So thank you everybody for joining today. This is going to be session 2 on the road to health and how to prevent or delay type 2 diabetes in your community. This is provided by the National Center for Health and Public Housing. And we're just going to briefly go over a few housekeeping items. First, this is just a reminder that all participants are muted upon entry. Please make sure that if you have any questions or any comments or any promising practices also that you may want to share, that you may do so in the chat. And also, just also a reminder to please make sure that you mute yourself when you join the meeting as well. Also, this meeting is being recorded. The slides and the recording link will be sent via an email to everybody once they're available on our website. And again, please make sure that you provide a brief introduction of yourself through the chat with your name, organization name, and the title if you recently joined. And then again, my name is Fide Pineda Sandoval, and I am the Training and Technical Assistance Manager here at NCHPH. And then I'm going to pass it on to Dr. Jose Leon.
Thank you, Fide, and good afternoon again, or good morning to you, depending on where you are. I'm Jose Leon, I am the Chief Medical Officer for the National Center for Health and Public Housing. Thank you so much for joining us. I see many of you joining from different states, from different counties, so that's excellent. We are very pleased and very honored to have you all and learn from you as well. We are going to be leading this session and giving you the information, but we would love to hear from all of you. So as Fide said, if you have any questions, if you have any comments, if you have anything that you would like to share with us, we can either use the chat or the icon, the phone icon, so we can unmute you, or the microphone icon. So please feel free to join this conversation. We love this conversation, or we want this conversation to be very interactive. We have some videos, we have some recap that we are planning to do, and some breakout room sessions to see whether we can gather some information and you will have the opportunity to know each other. So next slide, please. The National Center for Health and Public Housing is funded by HRSA to provide training and technical assistance to community health centers, even though we focus on those health centers located in or immediately accessible to public housing. We provide training to the 14+ health centers across the nation. The FIDE has shared 2 PDF documents with you. One is a short version of assessment, specifically if you want to know how healthy your patients are eating or what they are eating. This is a really good document that you can go over with your patients and check what they are eating, what they are doing right, what they are doing not so right, and to have the opportunity to offer some behavioral strategies, some behavioral interventions so they can change or make some modifications to their diets. The second document is a food program document. The document has the different publicly funded food programs in the nation and the website in case you want to reach out to them and see if you are not working with any of them or you would like to work with some of them. You will have the contact information there, and you can download the 2 documents from the meeting chat. Again, we are the National Center for Health and Public Housing. We are funded by HRSA to provide training and technical assistance to all health centers across the nation. Next slide, please. Just a quick reminder, we briefly discussed this slide last week. This is regarding the health centers that are close to or immediately accessible to public housing. Out of the over 1,300 community health centers, 458 health centers reported to be in or immediately accessible to public housing, and they provided services to 5.7 million patients. Out of the 458, 108 are public housing primary care grantees, and they serve over 900,000 patients in 2021. Next slide, please. Regarding public housing demographics, for us, this is a really interesting slide because we have the opportunity to know a little bit more about the social determinants of health and the demographic characteristics of those living in public housing. It's important to mention that 19% of those living in public housing are over the age of 65. 36% of those living in public housing are under the age of 17, and 43% and 26% are African American and Latinx or Latino. The other thing that I always mention is that 38% of the households report to have at least one person with a disability, either a mental or a physical disability. This is really important for health centers because this is a large percentage of people with disabilities. And if you don't have any program for people with disabilities, this is an opportunity to work with the public housing agencies or the public housing development managers or the person who is responsible for the developments to make sure that you offer care to those with a disability living in public housing, and at the same time, making sure that they have access to quality care. Next slide, please. So just a quick reminder, last session we discussed the basics of diabetes. We met two patients, Angela and Ray. We discussed briefly the risk factors and complications of diabetes, and we learned a little bit about how to measure portion sizes. Next slide. Today, we are going to have a brief discussion on nutrition labels, review portion and size definitions, and learn about the traffic size method. Next slide, please.
What's that chilling?
So just a quick overview of the diabetes and the glucose metabolism. For those who didn't have the opportunity to check the first video, this is another good video that you can share with your patients. So please share your video.
This video is to illustrate the glucose metabolism that happens in a normal individual versus a type 1 diabetic and a type 2 diabetic. So in a normal individual, when glucose arrives in the bloodstream, then we have insulin that arrives along with it. The insulin will dock onto the cell right here and allow the glucose to enter inside the cell. That glucose can then be used to create ATP and drive all of the metabolic reactions. So this is what normally happens. Now, in a type 1 diabetic, we have the glucose arrives from the meal, but there is absolutely no insulin present since the islet cells of Langerhans got destroyed from the autoimmune process, and the type 1 diabetics just absolutely do not produce any insulin, and therefore the glucose cannot make its way inside the cell. Now, in type 2 diabetic, the glucose will arrive here in the bloodstream, and there is plenty of insulin that arrives also. Usually type 2 diabetics have an excess of insulin, but only a few of them can actually dock onto the cell, or if they're docking, they're not docking properly. So there's the receptors just aren't working and aren't allowing enough of the glucose to come in. So a little bit of the glucose can make it into the cell, but not all the glucose. And then of course, a lot of it then will be floating around in the bloodstream. So there'll be excess glucose in the bloodstream and excess insulin in the bloodstream. But some glucose does make it here into the cell, so it can use some of it to function and to produce ATP. Now, of course, in the type 1 diabetic, what happens is the glucose cannot make it into the cell without the insulin, and therefore what it will use is it has fats right here in the cell. And so it will use the fats and burn them to create ATP and then kick out some of the products of fat metabolism into the bloodstream, which are ketones. And then you will see an elevated level of ketones in a type 1 diabetic. So you'll have in a type 1 diabetic, you'll have elevated glucose, no insulin, and you'll have some ketones. Whereas in a type 2 diabetic, you will have some elevated glucose, some elevated insulin, but some of the no ketones, because some of the glucose does make it into the cell for ATP production. Now, of course, since not a lot of glucose makes it into the cell, then what happens is it makes a person hungrier because the cells are starving because they're not getting enough of the glucose for the energy. So then they're hungry, so they'll eat more, and therefore there's more sugar that shows up and more insulin, and it keeps going on. Now, what happens to the extra glucose that is not used up? Then in a lot of times in both instances, that glucose will be converted to glycogen by the liver, and then if all the glycogen stores are full, it can also be converted into triglycerides.
Thank you, Fide. Next slide, please. So this is just a quick reminder of what we learned last session where we discussed this quick overview on the glucose metabolism and what happens in patients with type 1 and type 2 diabetes. Today we are going to discuss a little bit more about portions and serving size. The idea was to ask, what you understand by portion and what you understand by serving size. You see the definitions here. If you have an idea what the difference is, please, we can use the chat, making sure that we have, of whether or not we have some understanding about the difference between portion. What is a portion or what is a serving size? Any ideas in the chat? Someone who would like to say something that's going to be helpful and is going to help to introduce the topic. That is correct. Serving size is what is recommended or what is in the on the food label. Sometimes that is what we have. And what is the difference? What is a portion? Is a serving size is what is recommended. Then what do you think is a portion? You want to say in the size of your palm, whatever you want to eat. And Carrie is correct. I mean, we can, sometimes a portion can be the same as a serving size, but in general, next, a portion is the amount of food that you choose to eat for a meal or snack. And it can be big, small. That's what we decide. We can get 1 cookie or we can get 10, and that's and the recommended portion or the recommended serving size can be just 1 cookie or 2 cookies, but a portion is what we really choose. Fide next. So the definition for serving size or a serving is a measured amount of food or drink, such as 1 slice of bread or 1 cup of milk. Next slide, please. So this is an introduction on nutrition labels and how to actually read the nutrition labels. This is a guide that you can go over with your patients. Health literacy is one of the main concerns when you have patients with diabetes, and sometimes there are people who understand the labels, there are others who don't. There is a study that I was reviewing yesterday regarding nutrition labels, and the study was formed by the Food and Drug Administration in 2019. And it was showing that people with higher education, with better socioeconomic status, are more likely to read the labels. And in contrast, when you have people with the level of education is low, or they do not have the literacy to understand, they are less likely to read the label. So this is important. You can talk to your patients. And if you see this slide, we have some steps here. The very first step is to read what we call the serving size. It can be, in this case, is for a sample of macaroni and cheese is 1 cup. And that's another thing that I found really interesting. We can talk about a cup, that the one that we use when we cook, or a large cup where you can use to have coffee. So let's make sure that we understand that the cup is the right cup to measure this. Otherwise, you are getting more calories, more fat, more glucose, and more carbohydrates, and everything else. So the next one is that you need to check the amount of calories. This one is 250. And the calories from fat, when you have this portion, is 110 calories. The third thing that you have to talk to your patient is what they need to limit. Specifically, we are talking about saturated and trans fat and cholesterol and sodium. We need to make sure that we are reading these labels, and there is some instructions. When the percentage is less than 5 is good, and when it's 20% or more, we need to make sure the patient understand that this is more than what they need. So and then the last one is the vitamins. That's something that they need to get, so this they can get enough from these nutrients. And then the footnotes give us some information about calories and the content per 2,000 calorie, which is the average amount of calorie that a man can have. It's a little bit, the amount for a woman is about 1,800, and it's going to depend on whether or not the patient exercise, or the patient exercises, or the patient does any other activities. But it is very important just to go over this with your patients. And we have a question here. Do you say that the percentage of carbs is something to watch? Yes, yes, it is. Specifically, we're talking about patients with diabetes. And again, I mean, we can follow the instructions that you have here, the 520 instructions. 5% or less is good. The patients can have this because this is just 1 serving. Whereas if 1 serving has more than 20, that's something that they need to watch, because this is just a meal or a snack that they're having, and probably they are going to have more than 1. So we need to make sure that we offer that information. Next slide, please. Okay, we can run that one, Fide. This is a recommendation from FDA on how to read these labels and how to make really healthy choices for our patients. Next slide. I'm sorry, play this video, Fide.
Making healthy choices using the nutrition facts label. Choosing a packaged food or beverage that's right for you is easier when you check out the nutrition facts label. It's designed to help you compare foods and make healthy choices. The label has 4 key sections that help you weigh your options: servings, calories, percent daily value, and nutrients. And all this information is at your fingertips. Let's size up servings. Servings per container shows the total number of servings in the entire package or container. Serving size is based on the amount of food that is usually eaten at one time, and the nutrition information listed on the label is usually based on one serving. Since packages can and often do contain more than one serving, serving size is an important thing to know when you're deciding how much to eat or drink during the day. Let's check out calories. 2,000 calories a day is used as a general guide for nutrition advice, but your calorie needs may be higher or lower depending on your age, sex, height, weight, and the amount of physical activity you get each day. Curious about how many calories you need? Learn your number at choosemyplate.gov/myplateplan. Calories can quickly add up, so here's a tip. 100 calories per serving of an individual food is considered a moderate amount, and 400 calories or more per serving of an individual food is considered high in calories. Let's look at percent daily value and nutrients, two sections of the nutrition facts label that work together. The percent daily value, also known as percent DV, can help you figure out if a serving of food is high or low in a nutrient. For example, 5% DV or less of a nutrient per serving is considered low, and 20% DV or more of a nutrient per serving is considered high. You can use percent DV to choose and compare food products. Aim to get less than 100% of the DV of saturated fat, sodium, and added sugars each day. These are nutrients to get less of in your diet overall. Read the labels on packaged foods and drinks to find out all the facts about servings, calories, percent DV, and nutrients. And making healthier choices will be a snap. For more information, visit fda.gov/food.
Okay, so Dr. Leon, we have a raised hand. I'm gonna go ahead and mute Yvette Soto so that you can ask your question.
The video answer it. It's 2,000 a day. Well, actually, it says depending on age, weight, and there's a lot of
Phone charger? I said mama's bathroom, I think. You want me to get it?
Okay, all right, thank you. All right, so let's move on.
I have a question.
I will get it, yeah. Okay.
I have a question.
Yeah, go ahead.
Okay. In this case, if you go to the store, it's possible to see the price, the total of calories from the product. But if you go to from the fresh markets, maybe you pick up fruit and veggies. Well, you know what in the fresh products, know what is the total calories about it.
Oh, you're muted, Dr. Leon.
Sorry, that's a really
Yeah.
nice question, David. The FDA and the Department of Agriculture recommend that those foods that are processed, that all that are in a can, they need to have the food label. But for those products that you're talking, since they are considered healthy foods and they are low in carbohydrates, then these are not required to have the information that that we just reviewed. In fact, the recommendation for patients is to have healthy all these produce, either legumes or fruits, and it's not recommended, the amount of calories. I mean, we recommend portions. If we briefly review the My Plate recommendation is up to 6 portions of fruit and legumes that you can have, regardless of the amount of calories that you can obtain from them.
Okay, thank you.
Thank you. And there is here, I see in the chat as well that Yvonne is saying that she's pre-diabetic and her doctor told her that to stay between 50 and 75 carbs per day. That's correct. You know, it's going to depend again on the amount of exercise that you have, that you do, whether or not you exercise or not, whether or not you have other chronic conditions. And in regards to carbs, it's more than the grams of carbs. I am quite sure that you are referring to the amount of grams. I prefer to talk about the percentage of grams that you get, you know, on your regular diet, and it's about 30% of what we eat should be healthy carbohydrates. You know, anything that is not the sugar that we get from sugar cane or the other simple sugars that we get on our diet. Next slide, please, Peter. So again, we are going back to Ray, the person that we met last week, and he went over this, you know, and review the difference between the reduced fat milk and the non-fat milk. Look at the same, that the serving size was the same, that the serving per container was the same, but he saw the amount of calories, the amount of fat that he was getting from each of it, and the amount of carbohydrates, which is basically the same for both. The amount of calcium that is recommended. So we said that anything that is over 20 in this case is recommended because these are vitamins and minerals that we're getting. So he's very happy, and he is making some small changes, and that can lead to his reward. In this case, he's trying, because of his family history, to stay healthy and not get diabetes. Next slide, please. So his sister found, you know, that by having some potato chips and fried chicken and donuts, she was getting too many calories and some food that were not good for her. So she made the decision to change. So she changed the potato chips for pretzels, the fried chicken for baked, broiled stewed chicken instead of a donut. She got some pudding, and instead of the macaroni and cheese, she got the low-fat macaroni and cheese. So these are the kind of behavioral intervention that we can discuss with our patients. It's not that they can't eat some of these foods. It's just the fact to find a better option for them. Next slide, please. Same with fast food. We've been blaming fast food for many years on the obesity epidemic. And again, I am not the person recommending not to have any of these things, but we can make some good choices. Instead of having a quarter pounder, you can have a grilled chicken sandwich. You know, you are going to get less calories, you are going to get less carbohydrates. Instead of having the large French fries, you can have once in a while, and I'm saying once in a while, some small fries. And there's always the option to get a diet soda, even though it will depend on who you talk to. Some people recommend the diet options. Others only recommend water. And in my opinion, you cannot ask a patient not to have anything or to eliminate completely something from their diet, because it's going to be impossible for the patient to follow a diet like that one. It's just better to make some changes, making sure that the patient eating better and eating healthier. Next slide, please. Just a quick exercise. We did one of these last time. And when we are talking about Caesar salad, chicken Caesar salad, we see this as a very healthy option. So the problem is that now we have portions that are larger than they were in 20 years ago. And 20 years ago, a portion of a chicken Caesar salad had 390 calories, and we were talking about 1.5 cups. So just a guess, we are just guessing and just having some fun by doing this game, is how many calories do you think that we have in today's chicken Caesar salad compared to the 390 calories that we had 20 years ago? Ivan is saying 1,800. I see John 650. That's saying 890. So 500 to 7 portion sizes in the US are off the charts in comparison to other countries, especially with sweet drinks. And you are totally right, and Jesse. But let's take a look at the response. So 790 calories. So Carrie was I believe, very, very close to the number. And can you go back one slide? So the calorie difference is 400 calories. So just to keep that in mind, that because we think that our patient is saying that they are eating healthy, we need to make sure that we go back and talk to our patient about the size. And what they're having is not the same to have 1 spoon of Caesar salad dressing that half a bottle of the Caesar salad dressing. And so let's make sure that we are talking to our patient specifically what they need and what they have to do. Next slide, please. So remember, and this is something that our patients need to understand. We are like a balance, right? What we eat, the calories that we get are the calories that need to go out, and we achieve that by exercising. We just learned that the average calories that we burn every day are about 2,000 calories, for an average person. But if our diet, at the end of the day, we have had 2,500 calories, we somehow need to eliminate the 500 calories. And ideally, that's the reason why our patients, either our patients with diabetes, with prediabetes, or overweight or obese patients need to exercise. And that's something that we need to discuss next week, and the recommendations that we are going to get on how often and what type of exercise they need to have in order to burn some calories. Next slide, please. So just an example, when we are not talking about, when I talk to people about exercising, we are not asking about running or about biking or about going to a gym. It can be a daily activity like walking the dog. And if you walk your dog for an hour and 20 minutes, you are going to burn approximately 400 calories, probably the amount of calories that you are going to need, if you are having the 2,500 calories that I just mentioned. So let's make sure that the exercise program is done in conjunction with an expert and someone who can just analyze the background of the history, the personal history of our patient, making sure that these people can do these activities. Next slide, please. So now we are going to move to our next learning objective. And this is something that I found really interesting when I was reading this toolkit. And they have what they call the traffic light method. And going back to David's questions, David, if you see the green light, you see all the things that you can get, all the products, and so that is green for your patient. They can eat everything or whatever they want, but they need to be cautious about other package food that they can get in anywhere else. And the red light is just showing all the fast food and everything that is high in fat and sugar. So next slide, please. This is just a reminder as well about portions. This is another method. 1 serving of vegetable is about a light bulb, and we were just discussing the Caesar salad. I mean, the portions now are larger than 20, 30 years ago. That 1 serving of meat is about the size of a deck of cards, and 1 serving of rice, cereal, or potato is about an ice cream scoop. So this is another way that we can let our patients know how to measure their food, making sure that they get in the right portions. Next slide, please. Just another quick exercise, or just a quick reminder. In 20 years ago, that chocolate chip cookie had 55 calories. Now, the average chocolate chip cookie has 275 calories. And the size went from 1.5 to 3.5 inches. So we need to make sure, that we discuss this with our patients. That it's not just the size, or the number of calories, but also the size. That the size or the sizes have increased for many of these snacks and other desserts that we have. So making sure that they understand that. Next slide, please. Next slide, please. Carrie saying that she's really surprised, but the 1 ice cream scoop of cereal is 1 serving. Well, that's a really good point. This is something that we can stop for a moment and just have this discussion. And it will depend on the type of cereal as well. This is on average. When we have contact with our patient, when we talk to our patients, there are several brands, there are several types of cereals. Some of them are healthier than others, some are not as healthier as others. So we need to if we can talk to our patient, and if we ask our patient, what type of cereals do you have for breakfast? And I have this one. Please read the label. Make sure that you understand, and you don't understand what you really let me know, so we can go over, the label, and making sure that you're getting the right amount. And Cheerios and grape nuts. Cheerios is a good one. Grape nuts is a good one as well. It will depend on the preferences, but I agree with Jesse in regards to chemicals, additives, and extra sugars and everything else that they have. So we need to make sure that we read those labels carefully. And that's the main objective of the session, making sure that we understand so we can transmit that information to our patients. And the toolkit, that the PDF document that you received last week, it has this toolkit has some really good exercises, and they have the food detective exercise. So once in a while, it's really nice to go to the supermarket and just take some time and read the labels whenever we have the opportunity, so we can learn a little bit, about all these foods and processed food and everything that we have. So going back to the exercise that we had, and the cookies. So to burn the extra amount of calories in the large cookie, we have to watch the card for I don't know, fit the next slide, an hour. Assuming that that's the answer, an hour and 15 minutes. So it takes a lot of time to burn calories. It's very easy to get all these calories, you know, but to actually burn these calories is very difficult. That is also asking about the UCA application. Would you like to, if you got you on mute, can you just let us know a little bit more about the UCA application?
Sure. Actually, this was brought up by my daughter. Because for many years, since the 1990s, I've been trying to understand how the labels of in the food, you know, work. So my daughter, when she referred me to this, I was really perplexed, I would say baffled about the application, because you scan, it's as a scanner, you scan the product. And once you scan the product, it will give you how many calories, if it is good for you, if it has any chemicals, how harmful the chemicals are. And if it's not a good, if it's not green, it also uses like the traffic light application for food. And if it's not green, it means that, of course, it's not good. If it's yellow, you have to look at the precautions that they suggest, that you can replace that product, because it gives you comparables actually, of other products of a better quality, less harmful, less calories, less fat. So that you can try. I did it with, not that I'm a soda drinker, because I stopped drinking soda many years ago, but I just wanted, one of my favorite sodas was the coconut one. And then I realized, oh my God, I didn't know this had so much sugar. And it gave me the comparables with the bubbly drink that it's called bubbly. I don't know, it's a new thing now. And it has 0 calories.
Wow.
So,
That's amazing. You know, I have the $1 million question for you. Can you download this application for free, or is that something?
Yes, it's
There
free.
we go.
It's free. You don't have to pay anything. It won't charge you. But, and also if the product, when you scan it, if it's not there, it will give you the instructions if you want to add it to your, like your shopping list. If you want to add it, it will go automatically into the whole JUCA application for somebody else when they're looking for, and it take you through the steps, you know, like what does the label say, everything about the product. If it is detail on the back of it, you know, you can add it to the shopping list. And you also facilitate that product to other people, so that when they scan it, they will have it available.
Excellent. Thank you so much for sharing that. And I am quite sure that those participating in this activity, including me, will, you know, review the UCA app also. So this is really
You
great.
guys will like it. It simplifies your time in the supermarket, because we don't have time to actually be reading all the labels. But if we have something that will scan the label and you can read it and says, oh, well, you know what, it's recommending this other product. Well, let me try this other product. Let me just buy 1 bottle to see if it is good. You know, you can always go ahead and kill yourself later on if you want to go back to whatever you were doing.
Thank you. That's very nice. Thank you so much. Next slide, Fide, please. So Fide,
All right.
take it away.
Thank you, Yvette, for also that idea. I'm gonna be using that application myself, actually. So next we're gonna do, this is just like a very brief activity. I'm gonna post these poll questions, and if you can just provide your response. We're just gonna practice how to read a nutrition label based on the image that we see in the front on this slide. So for the first question, how many grams of fat will you obtain if you eat 1 serving of these chips?
That's great. Here we have 3, saying 3. So Jesse, Carrie, and Joanna are right. If you look at the total fat and the G is per grams, so you see that the total grams based on the nutrition label, the total grams are 3 grams. The total fat amount or percentage that you get when you have one of these baked ruffles. Next slide, please.
All right, so for the next question, we have what percent of the daily value do you get in sodium from eating this can of soup? I can't answer the full question. Well, you can provide your response in the chat as well. No big deal. Okay, I got it now. Okay, perfect. So yes, the correct answer is 35%. Is not B. And also in the poll, majority of people said it was 35%. And then for this question, I'm gonna have you provide your responses in the chat only. How many calories from fat is there in my favorite ice cream ever? 150 calories, 260, 17 grams. So the correct answer for this one is 150 calories. So it will be A. Thank you, everyone. And now, Dr. Leon, do you think we have enough time?
Yeah, we would like to do some breakout room discussion. Probably we can get back within 5 minutes, and just what we would like to know from you is, and what we would like you to do is just to discuss the resources that you have available, what challenges do you have, and the resources that you may need, you know, for instance, let me give you an example. We have been discussing resources in English. Probably you have a Spanish speaking audience, or you have other languages. So as we discussed, language can be a barrier. So let's see if we can do it in 5 minutes, and let's do the breakout rooms, and then we can come back. That works.
Give me 1 moment. All right, so I'm just gonna randomly put people in 4 different rooms, and you can go ahead and start your discussion as soon as you join, okay?
Did it work for you? Okay.
Hello.
Or Yvonne, are you in a breakout room, or are you still with us? Can you unmute her?
Oh, sorry. I'm joining them right now into the room.
Okay, got it.
That's why they still show up right now.
Am I in a room?
It seems that we're having some technical difficulties here.
Okay. I'll talk to you guys.
All right. So let's do it here. You know, we can use the chat, or we can unmute the line.
Okay.
So, but the first question is, what resources do you have available to educate your patients on how to read food labels, if any? We can share some of the resources that we have already been sharing with you, but we would like to hear whether this is an activity that you do with your patients, or whether or not you are having some issues, you know, when you are trying to talk to your patients about how to read the food labels.
So for me personally, our program just started. So we're just starting to work with our patients, and we've been talking about portion sizes and you know what foods, and about variety of foods, and then farmers markets and that sort of thing. But we'll probably just sit down with them and do a demo of what it is. I mean but I don't have a lot of resources yet to work with. So that was interesting hearing about the was it Yuka or
The app, the Yuka app. Yep.
very interesting and helpful.
Thank you.
Yeah.
Anyone else?
Yeah. So I like using the kind of like my plate. I mean, because there's also a Spanish version of it, because I have a lot of Spanish speaking patient. So I think, I mean, whenever someone asks me, kind of like, I mean, what should I eat? It's kind of like at first, okay, so let's go over with this kind of like, I mean, my plate. I also have like a list of low carbs food and snacks in English and in Spanish, so that they can have an idea. Because I mean, yeah, I mean, for some people, I mean, kind of like they want to change, but then they don't know how. So I think guiding them on, okay, this is something that will be helpful for you, and then measuring it, because the My Plate has also, I mean, it includes measurement of how many cups, kind of like, I mean, that they should be eating, like, I mean, protein, I mean, how many ounces. So yeah, I like using that, and also reminding them about the kind of nutritional labels that, I mean, if they're buying food.
Thank you so much for sharing that. I totally agree with you. And
Thank you.
we need to move to our second question in regards to additional resources. What resources would you need to discuss nutrition with your patients, keeping in mind that they need to be tailored to your patients, so the language needs to be simple and clear. So in addition to what is out there, the Centers for Disease Control and FDA and all these have some really good resources, but what else do you think you need, if any, or if you are okay with what is out there?
My takeaway is what I'm learning is I feel like access to fresh food resources, and also just I'm seeing that exercise is so much a part of just alleviating stress, and then also tricking your body into eating healthier. So I guess my big takeaway in the just educating myself is about access to fresh food, and then also exercise.
Thank you.
Yeah, I mean, for me, I have a patient who wants to attend like a diabetes support group in Spanish, and I cannot find any.
Okay.
So yeah, so I don't know if I mean, we have like a website that we can share to our patient, because I've looked and they want it for free. I don't have that resource unless they can go to like hospitals, but they have to have insurance. So
Right.
that can also be tricky. So yeah.
And thank you, Janice, because that is a really good segue for the next question, you know, the challenges, because we can have the experience that you can have, you know, the desire, you know, to have all these conversations with your patients, but sometimes there are some challenges like the one that you mentioned. So what challenges are you experiencing to help your patients maintain a healthy weight? I'm sorry.
For us in Minnesota, winter, it's pretty hard.
I totally agree with you.
It's been snow and ice. It's just been something else for the last
Mhm.
couple months. So.
Do you offer any type of indoor programs in the meantime when you have these severe weather?
Yeah, so we do have a lot of gyms, the YMCA, there's fitness centers that people use. People also go interestingly enough to like the Mall of America and walk around. And so people use like malls to go walk, and there's some skyways where people can go.
Okay. All right. Now, just quickly, we've been discussing about how to maintain a healthy weight, eat healthy, but we know that is expensive. So what resources do you have for your patients? We know that many of our patients are affected by many social determinants of health. So for those having those challenges, do you have any anything that to help your patients, either a funded program through your state or federal program?
Yeah, we do in Minnesota. We have SNAP and WIC.
Okay. All right. And so it's 3 Eastern time. I want to be very respectful of your time. We can continue this conversation or during when we have our session number 3. In the meantime, please don't forget to complete this post survey. That helped us a lot. So if you have any questions, you can also send us email. This is our website. And next slide. And please complete the post survey. And these are our emails. You see my email address. You see Fides' email address. If you have any questions, comments, if you would like to share anything that you would like to share, any promise in practice, let us know, and we can make some room for you to offer what you're doing. So thank you so much for the opportunity to talk to you, and see you next week.
See you, everyone. Thank you so much for joining today. Have a nice day.
Thank you,
Thank
Pete.
you. Thank you so much.
Thank you, Jose.
Thank you.